OB-GYN covers both obstetrics and gynecology. Obstetrics is the medical and surgical management of pregnancy, whereas gynecology is the medical and surgical management of the female reproductive tract. OB-GYN doctors see patients through puberty, adult life, pregnancy, menopause, and beyond. Surgery is a very broad medical specialty. Surgeons use manual techniques and medical instruments to physically reach into a patient's body to investigate or treat an illness or injury. The core specialty is general surgery, but there's a wide spectrum of surgical subspecialties which we'll cover shortly. Neurologists specialize in the non-surgical management of a variety of central and peripheral nervous system disorders, managing everything from headaches and migraines to devastating and incurable diseases like ALS and Huntington's disease. Plastic surgery focuses primarily on soft tissue, such as skin, muscle, and fat, to reshape or reconstruct a patient's appearance or function. Aesthetic plastic surgery involves procedures like breast augmentation and liposuction. Reconstructive plastic surgery involves procedures to correct facial and body abnormalities. Otolaryngology, also known as ENT, is a surgical subspecialty focusing on diseases of the head and neck region. This includes the vocal cords, nose, sinuses, ears, thyroid, and parathyroid, as well as head and neck cancer. Urologists are surgeons of the urogenital tract, which includes the kidneys, ureters, bladder, prostate, urethra, testes, and more. Urology can also cover sexual function, fertility, urinary continence, and gender identity. Diagnostic radiology uses machines to visualize what is occurring inside the body. Radiologists interpret these images and leverage the power of machines to both diagnose and treat disease. Physical medicine and rehabilitation is the jack-of-all-trades specialty focusing on the management of non-operative orthopedics and neurorehabilitation. Physiatrists are the primary physicians for certain nervous system and non-surgical orthopedic disorders, offering both medical and procedural treatments. Orthopedics, also known as orthopedic surgery, focuses on injuries and diseases of the body's musculoskeletal system, which includes a person's bones, joints, ligaments, tendons, muscles, and nerves. Ophthalmology deals with ocular and orbital diseases, which is anything relating to the eyes and immediate surrounding structures. Dermatologists manage diseases of the skin, hair, and nails using both medical and procedural aspects. A dermatologist can identify and treat more than 3,000 conditions, including eczema, psoriasis, and skin cancer. Cardiology is the most competitive and highest paying of all of the internal medicine fellowships. Cardiologists treat diseases of the heart and vascular system, many of which are quite common, like heart failure, hypertension, and heart attacks. Heart disease is the leading cause of death among Americans. Gastroenterology involves everything in the gastrointestinal tract, ranging from the mouth to internal organs like the liver and pancreas to the anus. They deal with a wide variety of diseases, including heartburn, inflammatory bowel disease, and hepatitis. Pulmonary medicine focuses on the respiratory system and diseases of the airway, lungs, and chest wall, such as asthma, chronic obstructive pulmonary disease, and lung cancer. Pulmonologists also manage patients who require mechanical ventilation and life support. Hematology and oncology are often lumped together because of how closely related they are. Hematology focuses on diseases of the blood, like anemias and clotting diseases, as well as cancers of the blood, like leukemia. Oncology focuses on the diagnosis and treatment of cancers, as well as the acute complications that can arise from cancer and its treatment. Rheumatology specializes in diseases of the joints, musculoskeletal system, and connective tissue. Rheumatologists see a wide variety of diseases, including autoimmune diseases like rheumatoid arthritis and musculoskeletal diseases like osteoporosis. Endocrinology focuses on diseases of metabolism and the endocrine system, which is made up of the pancreas, thyroid gland, adrenal glands, hormones, and more. They commonly see diseases like diabetes, hyper- and hypothyroidism, and obesity, as well as cancers related to the endocrine system. Nephrology focuses solely on the kidneys, which are responsible for many vital and complex functions in the body, such as regulating our electrolytes and fluids. Nephrologists see a wide range of clinical diseases, including renal failure, acid-base disorders, and hypertension. The infectious disease specialty focuses on microorganisms that infect humans, including bacteria, viruses, fungi, and parasites. Allergy and immunology. An allergist-immunologist cares for patients who have misbehaving immune systems, including people with allergies, respiratory diseases like asthma, immune deficiencies, and certain types of autoimmune conditions. Field of medicine concerned with alleviating gender dysphoria through surgical procedures. Any surgical procedure designed to help alleviate gender dysphoria can be considered gender surgery, including masculinization and feminization of the face and chest, tracheal shaves, voice modification, and even limb lengthening and shortening procedures. Reproductive endocrinology and infertility, or REI, is focused on helping people get pregnant who are unable to do so on their own. REI physicians are experts in all things related to conception and reproduction and are adept at managing any issues that may be preventing patients from becoming pregnant. Sports medicine doctors are non-surgical specialists who take care of musculoskeletal injuries for athletes and active patients. They address MSK issues similar to orthopedic surgeons, but not requiring surgical intervention. They can provide a full spectrum of care for anyone who wants to be active.